From whistleblower to architect of hope, the genesis and global mandate of Dr. Maya GPT, the catalyst. Turning systemic failure into global innovation. Innovation rarely comes from comfort. It is shaped in the heat of professional adversity. My journey from a specialist doctor within the National Health Service, NHS, to an independent architect of public health was sparked by the crushing weight of witnessing systemic misdiagnosis. For 4 decades, I have operated in the high-stakes setting of pediatric intensive care, yet the most defining period of my career occurred between 2004 and 2007. During this period, I worked as a salaried doctor and assessor at the pilot nurse-led family practice in Woking, Surrey, UK. There, I uncovered a center of misdiagnosis where strict protocols were valued more than the complex physiology of human illness. When I made a protected disclosure about the safety of unsupervised nurse-led clinics and their lack of formal medical training, the system retaliated. I endured years of investigations, false accusations, and a complete upheaval of my mental and physical well-being. However, I chose to turn this trauma into a proactive mission to defend the oath. This was not my first venture into innovation. I had developed the pediatric assessment tool, PAT, in 1985, and the Medical Advice You Access, MAIA, initiative in 2003. This shift from a clinician focused on institutional retaliation to a visionary constructing a global defense system was a necessary step for reform. We must stop safeguarding broken institutions and start empowering humanity with the knowledge needed to survive. The crisis of modern medicine, the limits of protocol-driven care. We are currently navigating a perilous era of doctor-centered care that depends on rigid, binary algorithms. Although protocols offer a statistical foundation, they become dangerously strategic when they replace clinical intuition. Statistics show averages, not the unique human being in the examination room. When we compel clinicians to tick boxes, we overlook the story of illness. This is why I declined to certify nurse prescribers in 2006. Their training lacks the depth of supervised hospital experience needed to think outside the box or identify the true focus of infection. The fundamental risk lies in the disparity between the nursing and medical diagnostic processes. 1. Nurse diagnostic process. Problem-focused, steps 1 to 3. 2. Identify single problem, pinpoint a symptom listed in a protocol. 3. Related factors, assess factors based on limited personal observation. 4. Defining characteristics, rely on signs that support a restricted knowledge base. 5. Doctor's diagnostic process, cause-focused, steps 1 to 5. 6. History. The story, gather a comprehensive narrative of the illness. 7. Hypothetical diagnosis, formulate a preliminary theory based on expert pathophysiology. 8. Clinical examination, conduct a physical assessment to find the focus of infection. 9. Tests and investigations, order targeted tests to confirm or rule out the hypothesis. 10. Targeted treatment, design solutions to prevent complications and death. The implications are staggering. Protocols fail 20% to 30% of patients. Consider the quackery inherent in the tragic case of a 6-year-old boy who died of sepsis. A nurse, driven by the emotional desire to please a mother's expectations, prescribed a low-dose antibiotic for a viral sore throat. This created false reassurance, masked the emerging secondary bacterial infection, and led to an avoidable death. True medicine requires a mindset shift, from protocol dependency to individual medical literacy. 3. Architecture of empowerment, the Dr. Maya AI methodology. Dr. Maya AI was designed to eliminate the culture of dependency that renders individuals susceptible to diagnostic errors. It serves as a strategic tool for risk stratification and self-diagnosis, transforming the story of illness into actionable data. This system enables individuals to distinguish between minor and serious illnesses without the need for brutal force or legislation. The methodology employs a precise color-coded triage system based on the number of symptoms detected. Color code action required reason red, 1 symptom. Speak to a doctor. A potential high-risk indicator has been identified. Red, 2 symptoms. Consult a doctor. Significant clinical concern. Professional assessment mandatory. Red, 3 symptoms. Rush to hospital high risk. Immediate tests, investigation, and treatment required. Blue, 1 symptom. Speak to a nurse, 111. Non-emergency symptom requiring professional guidance. Blue, 2 to 3 symptoms. Isolate and consult a doctor. High contagion risk, immediate isolation to prevent spread. Do not rush to the hospital. Green, 2 to 3 symptoms. Ask a nurse, 111, not serious or life-threatening. Symptoms are likely self-limiting. Yellow symptoms. Speak to a chemist. Minor illness, manageable with over-the-counter guidance. This system saved my life. While in India, I experienced heavy sweating and arm cramps. Despite not having chest pain, a common misconception of heart attacks, Dr. Maya identified 3 red symptoms. I ignored the false sense of well-being, went to the hospital, and demanded enzyme tests. These tests confirmed an acute myocardial infarction. The system I created to help others ultimately prevented my own death. 4. The looming shadow, AMR and the 20x COVID threat. While global attention remains on COVID-19, a much more deadly threat is growing: antimicrobial resistance, AMR. My warnings about superbugs started in 1989 after witnessing Marseille kill a healthy teenager in just 8 hours. Today, AMR poses a serious obstacle to modern medicine. It is projected that AMR infections will be 20 times more severe than COVID-19, echoing the terrifying lethality of Ebola. These deadly infections have no cure and can spread through air, water, and asymptomatic carriers, including the very doctors and hospital equipment meant to provide healing. Our current reliance on PPE and sanitizers is fundamentally flawed. Heavy fumigation often destroys friendly bacteria, allowing resistant strains to colonize hospital surfaces even faster. In my current work at the Martuvam Healing Forest in Auroville, India, I identify medicinal plants that prevent bacterial colonization rather than attempting the futile task of killing resistant bacteria. If the drug closet is empty, early isolation via self-diagnosis is humanity's only viable defense. We must shift our focus from institutional management to individual empowerment. 5. A mandate for global leaders challenging the status quo. To the WHO, the CDC, and political leaders, the doctor-centered model is a relic that cannot withstand the AMR crisis. Defense of the status quo is akin to trying to find a well while the house is on fire. You are operating under an illusion of theoretical idealism, detached from the practical reality of managing lethal, resistant infections. To survive, leaders must adopt a leads-to-change mindset. 1. Rethinking diagnosis, questioning tick box. Results to find the actual cause. 2. Beyond protocols, empowering clinicians to use intuition when algorithms fail. 3. Empowering patients, providing the knowledge of health to identify misdiagnosis. 4. Rapid information sharing, using digital tools like Dr. Maya for instant identification. 5. Personalized medicine, recognizing that averages do not save individuals. The stakes are existential. If you fail to empower the public, you risk not only the lives of the populace, but also those of your loved ones. 6. Conclusion: from ancient wisdom to digital protection. My journey has come full circle, from an NHS whistleblower in Woking to a researcher at the Martuvam Healing Forest. By integrating ancient botanical wisdom with digital innovation, we have forged a pathway to protection that does not depend on a failing system. The Dr. Maya app and the art of self-diagnosis are the realization of this vision. We must transition from medical dependency to individual sovereignty. We provide the tools to navigate the diagnostic maze safely, ensuring that every human can protect themselves. Knowledge of health is knowledge of life. The survival of our species hinges on shifting our trust away from those who claim to have found the truth and towards empowering individuals to seek it. Be prepared.